My job and the constituents who I have to answer to are the 1.1 million residents of Montgomery County.
Good afternoon, everyone. Good afternoon to residents of Montgomery County.
Dr. Travis Gayles grew up in Chase City, Virginia, with his two siblings and parents that raised their children with a strong sense of values. He is the first physician in his family and gives credit to his parents' hard work that created the space for him to have the opportunity to become a doctor.
I chose to go into medicine because from a strictly academic standpoint, I'm fascinated by physiology and anatomy. And it's one of the few professions where I think you can bring together the social aspects of how you interact with folks and how you work to create change and make things better with the scientific aspects or the biological scientific aspects. And then the other component is, still being able to do something that's working with people directly to see the benefit of the work that you're doing.
In 2017, when Travis Gayles took the job of county health officer, he didn't think his job would include leading a pandemic response.
We are living in unprecedented times.
Though it was something he had to study and think about, he will tell you in our time no one has had to put those principles into practice. Today, Dr. Travis Gayles is the face of the coronavirus here in Montgomery County.
Make sure it's securely over your nose and your mouth.
And he's worked hard to let people know this isn't about politics for him.
Well, even in a political setting, my job and the constituents who I have to answer to are the 1.1 million residents of Montgomery County. And so as a result, if you notice any of our press briefings, there's a couple things that I try to do is to say, for the folks at home watching.
I'd like to give you some insights for the folks at home into the world we live in.
Even if it's a question with a political band, because that's the audience who needs to hear it and who needs to trust what we're saying and trust the guidance that we're putting out. I also try to make it very clear that I am not a political official. I'm not an elected official.
Dr. Gayles!
And my job is to provide objective guidance. And so sometimes you may hear me say, from a health perspective, here is what we're proposing, recognizing that there are political influences that do complicate decisions that ultimately will be made.
He doesn't hesitate to say the work has been challenging, especially when the attacks become personal. He's been called arrogant and difficult to work with, and some of the criticism has been racist in nature. But in these instances, he always remembers representation matters, a lesson he learned early in his career.
I think it was my second year of residency. I was post-call. I was trying to get out of the hospital, and I was literally at the door, out the front door, and a woman just is yelling like, "Doctor, doctor, doctor." And I'm like, oh, what's going on? I'm trying to get home. And she came up and she said, "I'm sorry to bother you. I don't know you. My son has been coming to the hospital for years, and he has never seen a black male doctor before. And so would you speak to him and say hi? So I just want to introduce him." Because she said it was important for him to see that, to know what his scope of possibilities would be.
The COVID-19 pandemic has revealed further evidence of long-standing health inequities nationwide as well as here in Montgomery County. Dr. Gayles says these inequities have existed for many years, and it angers and frustrates him because there's been no system created to move beyond identifying the problem.
And so my hope is that post-COVID that we continue to have these conversations centered around why those disparities are in place. Everybody's gung-ho about contact tracing and let's put money here and put money there. Public health has been woefully and inadequately funded for years. And so I think this is a great opportunity to create a modern infrastructure that's up to date from a technology perspective and has the type of resources in place to not only implement some of those systemic changes that need to happen to address those health disparities, but really move the agenda to the next level.
Though there is a light at the end of the tunnel with this pandemic, Dr. Gayles says we as a community have an opportunity to take not only what we have learned from this crisis, but also to use the current racial and social justice climate to come together to address these social determinants.
I think of the opportunity in the space of giving representation and voice to all the other people who don't have access to this space, And so not forgetting when you're sitting at the table in decision-making capacity to call out those isms and those phobias and to call out those disparities and to hold people accountable, because unless we do that, we'll just continue to gloss over and we won't do the internal work that we need to do as individuals, as a county, as elected officials and so forth, to again create that systemic change that needs to happen, so we're not talking about the same issues 20 years later that we already know existed in our communities.